I think there are a couple things that are we're still waiting for, and Amanda's gonna kind of give a little bit more detail on that in a little bit. But the idea here is what captures the legislation, the interest of the stakeholders, that's you, and what data could we find to support those. So we're nearly there. Again, we'll get an update on that, but very happy to be kind of shifting our view to the scoring approach. Is just how do we combine the data and score communities, which is something that we have been working on really hard, and have some thoughts to share to you. And then also the designation, and this is like how do we slice the cake. So if you go from the ingredients, which were the indicators, to the cooking process, to do we make two cakes or do we make a giant cake, and how do we slice it up? That part is really, do we designate 40% of New York census tracts? Do we designate 30 or 25? How do we break that down regionally? We've had discussions on that so far. We're going to continue to have discussions on that. It will be a place where we think the scoring approach, the indicator selection, and the designation are places where we're going to ask you to vote on certain decisions coming up. Not today, but coming up very soon. Last one is the ground truthing, and I know I feel like a kind of a broken record on this, but like this is how we build it, and this is how we like create the cake that actually tastes good and works for everyone here. And we've actually built the Tableau tool now to directly get your input into it. So let's continue on this line so we can chat through that. As always, interrupt me if I'm just going off and you guys have questions. Chris, you want to chat about timeline?
Yeah, thanks, Alex. So, as it comes as no surprise, right, we do have timelines here and a schedule we want to try to build some more clarity around. There are a number of interdependent, work streams, right, as we're thinking about the draft criteria to identify, communities that would be considered to be disadvantaged under the CLCPA. There's also work being done to develop the benefits framework so we can look at how, to identify and ultimately track and report out on benefits going to those communities. And then in addition to that, there's all of the work that the Climate Action Council is doing around the scoping plan. And so all of these pieces or work streams, there's some dependency on the work that this group is doing to develop, the draft criteria. And so as we're looking at the calendar, we want to, make sure that we're thinking about the process that is yet to come, right? So by law, we need to engage in a public comment process, which, needs to last for at least 120 days. So we're, as a staff team, we're looking at the calendar and trying to kind of work backwards. So if we want to, have a final set of criteria that can be used, for the tracking and reporting of benefits, but then also to inform the work in the scoping plan by the end of the year, we're going to, need to get kind of our draft criteria in a position to be ready for, public comment in early August, right? So working forward, that gives us, kind of, a portion of August, September, October, and into November for the public comment process to play out, and then also, sometime in November and early December to, to deal with the public comment that comes in and make any calibrations that are going to be necessary. So, we'll want to make sure that, we spend, as much time as we can here in the next, month and a half to really kind of, have the discussions that are necessary. As Alex said, there's additional tools and support that the team is pulling together now for the working group to better, assess the various indicators. But we're going to need to spend a good portion of time here to, kind of, discuss and assess the criteria to get us to a point where we can have a set of draft criteria ready in August. Alex, you want to kind of go back to the timeline, or maybe we could do that after the fact? I forget where that falls on the slide deck. But,
yeah, let's talk about that at the end
yeah.
if we have the time to do that.
Yep.
Since we have so much to cover. But it is aggressive. And to that point, throughout, as you're thinking about what we're talking about today, if there is anything that will help facilitate your review, if there's any way that we can make it easier, I even have like a slide later where we can share and discuss that. But please think through that, because we want to build it so that it will make it as easy as it is for you to review it and get your thoughts and comments in there. Make sure you're heard. So we're going to describe today's scenario. Again, we just have one to show you. Not just, it's actually really, really cool. And there's lots of stuff going into it now. So Amanda's going to give a brief description of the different components here. And we're hitting on these just a quick, because these are parts that, again, we think that you're going to need to vote on to make decisions so that we can go forward as we give you scenarios. So here's a little bit of the theory discussion. We will get into the grounded. This is a DAC, this isn't on the map. So hang with us while we go through this to tee up what we're going to show you later. Take it away, Amanda.
Thanks, Alex. So when we say scenario, we talk about this word criteria, and criteria is about a lot more than just the data going into it. So when we say scenario, the things that make up the scenario are the indicator list, which is the ingredients to the cake that Alex showed, how to score the data, which is how to bake the cake, and then how to slice the data. So whenever we say scenario, we're showing one scenario, we're talking about all three of those components, the indicators that go into it, the scoring approach, and then how we slice it. And all three of those things are things that can change. So really what we're trying to do today is show just one starting point where we took kind of a simple approach to how to score the cake and how to slice it. Once you start reviewing that, we'll know, okay, how do we move this? And some of our levers that we'll talk about are changing the indicators, changing the scoring, which is really changing how important different indicators are, and maybe changing how we slice the cake. So I'm just going to talk through, for the scenario that Alex is going to show in maps, what those three pieces are. So starting here, I think, we've shared this slide before. I know it's abstract, but, something to consider in scoring, how important the way we combine the data is. So at this point, we actually are using about 40 different indicators. This is down from 160 indicators that you and others suggested when we started this process. We pulled data on about 90 of them, and we're down to 40. So then the next question is, how do we kind of group and combine things? How do we figure out what's more important and maybe give more weight to things that are more important? So the first thing we're doing is kind of grouping things by what they capture, which we're calling factors. So we have one big group of burdens, which is exposures, hazards, threats, history of discrimination that you might see in land use or zoning, red line scores, climate risks. That all falls into burdens. And within burdens, we kind of group things into environmental exposures, a bunch of different things associated with historical discrimination and land use and siting, facilities that might be hazardous, other things like red line scores or zoning, as well as a group of climate change indicators or climate risks. And then the other set of variables we have that we're grouping, we're calling generally population characteristics or vulnerabilities. And again, we kind of group those into socio-demographics, which includes income, race and ethnicity, language, education, and unemployment, a bunch of different health indicators, and things related to housing costs, mobility, and communications. So what we're kind of doing is grouping those things into burdens, which are the things that kind of people face, and vulnerabilities. And as California did, grouping those together and then multiplying them to create an overall score. And then there's a couple ways we can score. We can score everyone statewide. So there's 4,918 census tracts in New York State. We can put them all, line them up and rank order their overall scores. and look at the top 25%, 30%, 40% statewide. We can also construct regional scores and use the exact same data, but only compare each tract to others in its region. So take all of the New York City area census tracts together, where certain indicators might mean different things, order up all of those and take the top 25%, 30%, 40 of those. So where we have landed over time is what we're calling the have your cake and eat it too approach, where we're both calculating that statewide score and the regional scores. Right, and then so once you have those scores, the question is, what is the percentage of those scores? What high scoring community should you actually consider as disadvantaged communities? Because for your purposes in the legislation, it's not just creating a score, it's designating a community as a disadvantaged community or not a disadvantaged community. So this kind of illustrates, in this one scenario we're showing, just to see where things fall and see how you feel if communities designated or not. We're taking the top 25% of each of those scores, and any community that falls into the top 25% of the statewide scoring system or its regional scoring system in this scenario gets designated as a disadvantaged community. And that ends up covering about a third of the state. So in what you're going to see, we're covering about a third of the state. So any questions on that kind of scoring approach before we go on?
Excuse me, this is Jared Bly. When you say covering about a third of the state, you mean spatially or like population density?
It's about population because census tracts generally have the same population as other census tracts. That's how they're designed. So we have about a third of the census tracts in New York covered, which equates to about a third of the population.
Okay, thank you for clarification.
And we're totally happy to go over this in more detail in small group tutorial sessions, one-on-ones. I mean, we would love to get into this with you.
Yeah, you just asked us to nerd out, and we will. Right now, again, we're trying to hit kind of the right level so that we can get to the maps. But I had just to say that. We'll nerd out with you anytime.
So these next two slides have the indicators and data that is currently in this current scenario that we're going to show you, understanding we're still working on fine-tuning a few things. And this is, a point at some point I would imagine we'll have, kind of a separate vote on indicators, so we can provide this list here and more information as needed to let you really have time to go through the indicators and get comfortable with them. In our documentation, we're also planning to show not just the final indicators that we're including, but all of the indicators that were considered or screened that we analyzed data for and opted to go for these specific indicators. So in some cases, many of the indicators that were proposed and we screen the data on are very highly correlated, or really just another way to calculate these indicators. So on the burden side, we again group things into potential pollution exposures. This middle category, which we're calling, and you can feel free to rename it, land use associated with historical discrimination or disinvestment. So things that might have been hazardous in the future might still be hazardous. We don't know if they're hazardous, but definitely associated most likely with some discrimination and how they were cited. And then potential climate change risks to get at that aspect of the legislation that says vulnerability to climate change. So I'm not going to go through the details here. On the potential pollution exposures, we're pretty close. There have been some requests by state staff with air pollution and other expertise to consider alternatives to EJ screen indicators. So in some cases, we're looking for DEC or New York specific data to replace EJ screen data. And that's what some of the asterisks are that you see. In that middle column, there's also work underway to include several other types of regulated and permitted facilities. For example, you don't see power generation facilities here. There was an EJ screen data on that, but the DEC is helping us get that together. And they've proposed, again, some New York specific things for other things. But for now, we do have the EJ screen data, and we have a good amount of things that kind of can approximate this. And then new to this scenario is much more information on climate change risks. So covering off on extreme heat, risk of coastal or tidal flooding from sea level rise and storm surge, inland and riverine flooding risk, including low vegetative cover to get at urban heat island effects, agricultural land to get at both the land and workers who might not be documented in a census. And then just wanted to provide a couple things that might relate to distance and challenges of rural communities in climate emergencies. We have distance to grocery stores, and then we might include distance to hospitals or emergency care in the future. Okay, and then on the vulnerability side, we're probably even closer. The census provided a lot of data, and I know, the census really isn't specific enough in the way we want it to be specific with race and ethnicity. So we're doing what we can, and definitely understand there's limitations, and the documentation can kind of cover what we see as some of those limitations. On the health impacts and burdens side, we have asthma and ED visits, COPD, heart attack, hospitalization rates, and then some census data on health insurance, disabilities, and older adults. And DOH is still working and might be able to provide data on lower birth weight births and premature deaths in time for this draft scenario, but still there's always the chance with our timeline that we might not be able to fit all of the data that we'd love to have in this first definition, but we understand, with this opportunity for annual reassessment in the legislation, we might be able to add things in later versions.
Quick question, Heather?
Sure.
The list of socio-demographics, that's not exhaustive, right? Like I'm not seeing percentage of Asian population, for example, but I shouldn't worry because this is not an exhaustive list, correct?
That's a good question, and we'd love to hear as you. This is what is in the current scenario today. So if you aren't seeing something, it'd be great to message us or ask about it, and we could, discuss that a little bit more.
And Eddie, to your point about percent Asian, just really quick, we did actually model that. We put it in and tested it, and we ended up finding that a better way to kind of get at vulnerable populations, Asian populations in particular, are limited in English proficiency, because percent Asian actually can shift things away from some of the places where we think are more kind of in need to be designated a DAC.
Gotcha, thanks.
But again, I mean, you'll have these slides, and I think, and one of the things that I think is particularly important for all of you to see, in which we don't have time today to do, but tell the story of 160 or however many we went to down to 90 that we downloaded and really dug into, and those, we keep adding as the things become available from the agencies, down to these 40, and why we chose these 40. And there was a very good reasons for that. And so I think telling that story and documentation and, in a future one where we kind of really dig into that, I think is very important. So what we're putting in and the reasoning behind it.
And Alex, this is Chris. So I think the other thing that we want to make sure we do right is with these 40 indicators, as folks are kind of going through and looking at these and kind of looking at the scenario, if there are other indicators that are not present here, and we've either documented them before or we haven't, we at least want to identify them so we can assess whether or not we have the ability to access that data right now, and we can kind of build that into kind of future iterations. So let's make sure we capture anything that's missing.
Yeah, absolutely. I think we're going to be making a lot of documentation, and also we do want to hear if there's anything that you see that's missing.
Great. This is Rawa, and I just wanted to, I haven't seen anything on Indigenous communities. is there anything that we can pull on? Is there a reason why it's not listed?
There is the reason why it's not listed, and I will try to talk about that. I don't know if Rose is still on to talk about that more, but the census data available on Indigenous populations doesn't really align with Indigenous land or territory. So one thing we're thinking of doing is really figuring out what the designated tribal land or territory is, and really adding that in more explicitly after the quantitative scoring. So rather than being, we have our score itself where all this data goes in and generate a score, and then we have the ability after the fact to very explicitly designate things. One thought that had been discussed, which we would definitely love everyone's feedback on, is finding those specific areas and designating those census tracts. Does anyone from the state team want to say anything else about those discussions?
I think we lost Rosa, but I think we should talk through this next week when we're digging further into the scenarios.
Yeah, one of the things I think is important is, we're talking about all the quantitative stuff, but there are some things that are so critical that we actually want to pull them out and make sure that they happen. And Indigenous populations is one of them. So the trick then is how do we explicitly talk about that in addition to the current scenario stuff? So I'm gonna, cause I'm not in the thingy, the presentation thingy, I'm just gonna put for next week, a talk about, critical populations that we're worried about missing.
Alex, can I make a pitch to add for next week? A little discussion on the health impacts and burdens. I'm a little, and I'll say this as an admitted non-medical professional. This list seems light. It seems like there are health impacts that we're missing, particularly when it comes to climate vulnerabilities. And I wonder, have you all had the opportunity to run the health impacts list before we settled on this, on E6 or whatever? Did anyone from the Department of Health have any input or feedback when it came to this? And if anyone could speak a little bit to, where they shook out, because again, it just seems like this is it just seems like they're missing health impacts, but I'm blanking at the moment.
Thank you. That's a great question. I will try to answer that and then pass it to Neil. So we did have pretty extensive conversations with DOH folks, both on the public health side and epidemiology side, about specific indicators that would be, first thing, what's relevant to this definition, what would we want to be included, and then what data do we have on things, that's recorded data. So it's definitely consideration of other, health impacts and outcomes like cancer and diabetes that you might expect to see on this list, and some discussion about, how those might be correlated or picked up by other things. So we could provide documentation on that, or possibly, more information on that in the next meeting. Neil, do you want to speak any more about that process?
Hey, Amanda, thanks. No, I think, Eddie, appreciate the question, and we're certainly willing to, if there's specific indicators that are missing, we're happy to just not necessarily reevaluate, provide a more detailed follow-up if it's helpful. But I think Amanda's explanation was spot on. I mean, it's always a balance between, especially when you get down to finer geographies, kind of about to being able to provide the data with also maintaining the confidentiality that starts to present a problem with small numbers as you get more granular. And so this is kind of what you see represents that balance, in addition to working on low birth weight births and premature deaths. This is kind of where we landed in having a balance between enough numbers at the census tract level and still, capturing, I think, a lot of what we felt were important. As I said, happy to add more though, or consider more, or provide follow-up to you if it's helpful.
Thank you. And yeah, I think it would just be helpful for us to understand why these and why not others, and what constituted more of a health risk that elevated these, and why cancer and diabetes were less so. Like it just be it's the kind of, I think, context that I think we would welcome. And the one thing that's like jumping out at me, and it just shows you this really hopeful moment we find ourselves in New York, but like no mention of COVID, just it's jarring not to have any kind of mention of COVID. Although again, having the lowest, I don't know where New York State ranks, but I know I keep hearing about how low we're ranking in terms of infection rates. That's great. I'm just wondering if there should be. I don't know how you all have processed, especially since we, like that Harvard study last year showed that because of COVID, even slight decreases in PM 2.5 would have led to hundreds less deaths. The connection between COVID and specifically cardiopulmonary vulnerabilities. Again, maybe this is something we're on the upswing and we no longer have to worry about, but I would just urge us to at least have some response for the inevitable. Well, why are COVID vulnerable communities, those that are maybe still lagging behind in vaccination rates, for example? And again, maybe this is not a problem in 6 months, but that also jumped out at me. I'll stop there.
I'm just going to jump in there and actually say that the COVID data, I think, will show a pretty good historical discrimination issues with how it was addressed. So getting those data is something that we are working on. I think that there's also this timing part of where we're at now, which is like building something that we can get at least to work now, and then also that we need to come to the understanding that this is not the last time we're going to do this, and so we need to then have things of, okay, we have this data now that we're going to work with. We have identified these different data points that we really need but can't get for this iteration of the criteria, but we better get them next year. We're going to try really hard to get them next year so that we can then assess where it is. And I think COVID is definitely one of those.
Neil, do you want to say a couple of words about COVID data availability? As I recall, a couple months ago, it was still kind of open cases under investigation, so couldn't be used yet.
Yeah, I mean, I think it's also something, I think we'll have to follow up with the folks who are stewards with those data too, to find out where they're at. And I think, some of our initial discussions, to reflect what Alex had said, I think the way we are concepting is perhaps it would be interesting to look at kind of layer the COVID data with the disadvantaged communities data in the future, if that becomes available. And to get back to your earlier point about the technical documentation that's being created, that'll include both indicators that we are including as well as those that we aren't, right? Just in terms of being transparent about how we consider different options.
Exactly. The technical documentation will have a big table of everything considered and rationale for screening things out.
We all love spreadsheets because it's big, and there are basically kind of comments in there of why we decided to include it, or investigate it further, and then why we decided not to include it into the models, those types of things. So we'll have to keep going. But I do want us to move on. That said,
I have a quick
Yep.
follow-up. Hi, it's Alana. I just have a little bit more insight on the questions dealing with the indigenous populations. Our Indian Nations and Consultation Coordinator, David Witt, did extend an invitation for nations to have a conversation on how they would like to be included in the definition, if at all, So far, we haven't gotten a response on that, but there has been a follow-up invitation sent. So that's just, if anybody had any questions about that, that's where we are on that.
Thanks, Alana.
Alana, I'm so sorry. I missed the first part of who reached out to whom. I didn't get that.
Oh,
If you could even
sure.
put it in the chat, that'd be great.
Our Indian Nations and Consultation Coordinator, Dr. David Witt, reached out to the nations that we work with, the represented nations in New York State, to see if they would, what they would like to see, if they want to be included at all.
Thank you.
So Rawa, I think we can try to get an update on that. I'm just going to add this, like we're building an agenda for next week. This is super useful. But I'm not sure where we'll be with this, but check in with David.
Alex, I have one other question that I think I posed at some point when we were talking, and I'm wondering whether to bring it up because I think it might be covered because of all these indicators, but a lot of Asian populations and how we're thinking about that. I mean, there's a huge diversity in that. Bangladeshi immigrants in Queens, for example, are dealing with huge environmental health issues, and it's not really been part of this discussion at all. And so I think I'm looking at these indicators and I'm like, I think they would be covered, but I would love if there's a way of checking if that's true.
Yeah,
that would be great.
Yeah, so no, let's talk about that, because we really have tried to figure out how to capture specific enclaves and populations within this. And again, we've talked about the really not enough or good enough granular data by census tract for race and ethnicity, and to try to identify certain kind of particular groups. And one of the ways that we're doing that is through limited English proficiency. And I'm biased as a linguist, but I want to add more there too. One of the things, we're going to get to this, but in the maps, what I would love is if you know where those enclaves are, to really dig in and make sure that they're captured. Because just like everything else here, it's like we've got 40 things, a lot of them are correlated together. So even if one data point that you think is really important is not in here, you're probably going to cover it with all these other things. So we need to just make sure that we're getting the maps, that we're capturing the people that need to be captured based on your experience. So let's talk about that in a minute. I know that Amanda wants to move on to yet another metaphor. I apologize, but this is a good metaphor for us to talk through stuff. So I'm going to skip. Wait, where'd it go?
Was it toward the beginning of that section?
No, but it was so cool. Somehow it got lost. Oh no.
Okay, well, let's go back to the
Here it
slide.
is.
Oh, great. Okay, great.
There we
Okay.
go.
So all these things we've talked about, it's, indicators are just, one piece of this process of how we bake the cake. And with 40 or so indicators in here already, some of them are very highly correlated. Adding one additional indicator doesn't really tend to shift things that much. So we just kind of want to establish the context for, yes, the indicators are important, but with so many, there's only so much you can do by adding another indicator. There's two other, big tools we have to really move the earth and reshape things. So one really big thing is what we're calling this designation threshold. So once we have the scores and the communities rank ordered, what percentage of those top scores do you think are disadvantaged communities? Is it 25%? Is it 30%? And that might seem like a really hard number to choose, but what we can do is really show that in scenarios. So we can show you a scenario of, okay, these are the communities that would be designated if we only took the top third. These are the communities that would be designated if we took the top 40%. And you can see what those communities kind of on the edge are, that we're in one scenario, not by the other. And you can really think about, do I agree with that? Do I really think those should be disadvantaged communities, or should they not be? And obviously there's a lot of funding, implications in that too. So that's one really big tool, is kind of where to draw the line once we have the scores. Another big tool is this thing that we're calling factor importance. So really how important these different things are. We can put the things in, but then we also have the ability to group them. And what we're thinking of doing, which California did, is treating some of the groupings as more important than others. So one big example is DEC staff specializing in, air toxics, pollution, hazardous sites have really suggested that environmental exposures, kind of measured pollutants, be given more weight than formerly hazardous sites or something like that. And that's something, you can decide and you can play with. Another example is, do we want to consider, health or sociodemographics to be more important than, housing considerations? So yeah, just want to keep in mind as you see this indicator list, yes, we can play with these indicators and add things. They're all very correlated. Kind of changing the indicators and changing the indicator specific weights at this point might be more of, a manual shovel to change the process versus kind of the designation or the factor importance, which could change things a little bit more. Right.
So we got another metaphor. I think this one's useful to keep in mind, and particularly important when we start talking about and thinking through these different areas that you need to vote on. We only have about 15 minutes left. I do want to talk about this current model and how it's weighted between factors. Amanda, you want to chat through that real fast?
Sure. So that's that kind of second earth moving step of what we're calling factor importance. So once we have these things in groups, the groups you saw on the other slide, should we count one group as slightly more important within burdens or one group as slightly more important within vulnerabilities than other groups? So for this initial model, which is totally just a starting point and we can change this, we did give more weight and more importance to those pollution exposures like PM 2.5. We also on the vulnerabilities side gave relatively more weight to socioeconomics and health impacts and burdens. And again, this is something like we don't know what the right number is, and it's really going to come through in ground truthing when you start to look at communities and you give us reasons. It's not just telling us which communities you think should or shouldn't be, but why. Because when you give those reasons and write out why you think a community should be a disadvantaged community, you're going to tell us what you're seeing and what indicators you're seeing that you don't think are well reflected, and that creates kind of this feedback cycle and loop that we can use to move things like this if we need to.
Abby, I see your comment about leave no DAC behind, and I think you're right. And again, I think one thing that we want to really lean into here is we only had an hour today, so we wanted to kind of cover the broad swath and then also leave you with a task at hand of kind of providing some feedback on where we're at with this current scenario. But there's still so much for us to really jump into and the details in addition to the maps. And so next week, I feel like we're going to have a lot to talk through, and anything you can give us today of like, this would really be helpful for us to have, we can try really hard to provide that in anticipation of next week, because we do have to start really making some decisions. But I wanted to, since we only had an hour, I wanted to make sure that we were getting you what you needed today to kind of look at the maps and, give that kind of assessment of that first scenario. Any questions or thoughts? Moving right along, you've been seeing some of the maps that we've shown you in Tableau before. We've added to it now, and I'm going to go through a lot of this. This is really so that this screenshot is really there so later you can pull in and be like, oh, that's what that means. We have now 2 different kind of pages for you to look through, because eventually what we're moving toward is you seeing multiple scenarios, and then that means that these tables then are going to have different breakdowns based on the different scenarios we have. They're pretty much static, so they're not on the same map part anymore, but they give you a sense again of how that one scenario breaks down between a DAC versus not. So that kind of stays the same. What we're going to ask for you though, that will really help us, because again, you being the on the ground experts of your represented areas, what really we need is a way for you to give us information about what's wrong, but also what's right. And this is more of a statistical thing in a lot of ways, but if you are thinking about, you see this map and you're like, it's easy to gravitate toward, well, what about this one? Why is this one not there? What also helps us is to know and make sure that we still capture the things that you think are right. And in this case, it's like, okay, if you see this one and you're like, yeah, that is so totally a DAC, and we have got it right. It's in there and it's captured. And the reason why, that really helps us to make sure that that stays captured, and also to find out what specific thing about that DAC that really is well and truly a DAC that you agree with that we captured, so we know to keep it. And then with the wrong one, so once you tell us when something's right, buy one, get one free here. Tell us something's right, tell us something that's wrong, so that then we can start building up this database of ground truth census tracts. And we're making it easier for you now. So I promise you don't have to like individually email me like these different tracts. Buy one, get one free, please, please. Okay, then because of that buy one, get one free, this new statistic that's going to be coming in is going to be super helpful, because then what we're doing is building up this database of the census tracts you've already given us and saying like, oh, this is totally this is totally a DAC. You've got the percent agreement and total of what this scenario agrees with what feedback you've given us. And I want to point out, in this current scenario with the information we currently got for from different working group members, those that should be a DAC are 94% agreement in this scenario. So that's awesome. There's still room for improvement there. Shouldn't be a DAC, that doesn't agree as well. And that's because we don't have as much data there. So we really need to have more data there to be able to kind of really assess that. And Eddie, you're asking about what document we're reviewing for the ground truthing of the DAC. And it's going to be the world's coolest Tableau. And here it is. So I'm going to show you this with a full expectation that I'm happy to go over this over and over again with anyone that wants to, because it's a lot. But let me take you through what this looks like and how it can help you give us the ground truthing information. On the left-hand side here is a little data survey thing where you can tell us whether something's a DAC or not. At the bottom here are the state averages. This stays static, but it helps you then to kind of compare and contrast what you're going to see here in this bottom table. This bottom table is something that's dynamic at this point. So who wants to tell me where to go today? Someone tell me where to go. Anyone?
Riverdale, the Bronx.
Riverdale. Okay, I'm just going to do the Bronx. Oh no. Yeah, kind of got it. Okay. So what we've got now, the Bronx, and we still have the hover over where you can go through every single census tract here. And let's see here. Amanda, did you want to ask something or make sure that I'm covering?
Oh, I'm just is the only way to see whether it's a DAC to mousing it over, or is there a big picture view that shows you on a map where the DACs are and then you can zoom in?
Well, it's kind of hard to see here. Let me so here we go. You can see the orange.
Okay.
I had just selected something to show that part, but you can see the orange. Those are designated to the DAC versus not. And as you zoom in, one of the things that I should note is that I made it a little bit more see-through so that you can see some of the land behind it. So it's not as like starkly orange and white as you can see. But I'm going to zoom in a little bit more here. So let me take this and go here. And this is actually kind of a useful one because I can go here and be like, well, why isn't this a DAC where everything around it is? So here's where I want to show you what happens. If I select this one DAC right here, census tract, oh, come on. It's putting in a lot of data, so that's going to do now is pull in at the bottom, there's some information. But if I select that one DAC, I see it's census tract 360610221002. That number is now reflected right here in this track number. And Eddie, I'll put my name here. Alex Dunn, I put my name in there. You only have to type that in once. And I think this census tract should be or should not be a DAC. Eddie, should it be a DAC or not?
I can't, as good as I am, Alex, I can't look 30,000 feet down from the satellite.
What are you talking about?
Unless that's Fordham, maybe that's Fordham University. In that case, no, it's not a DAC, but.
I believe that's Harlem. We're looking at Harlem, not the Bronx.
Oh, okay. Well, see, this is the thing with me and not knowing where I am. Okay.
Oh, so if that's the Upper East Side, that's not a DAC, so we're good.
Okay. So I'm just gonna say it shouldn't be a DAC. Woohoo! And then here's why: university, and definitely not a DAC. But for good reasons. High income.
Well, there's not a university right in that specific space. There's one nearby, but that's not a university right there. But I agree, it doesn't need to be a DAC, that little space.
Okay. Well, this is good. See, agreement. Nearby university, high income, because it is high income. And then I hit submit, and voila, I have submitted it. And then it will pop up on your like web browser that you've submitted some information that you're not seeing here. But what's awesome about this is like you don't have to then write down the census tract or anything like that. So I think that this will give you some information. Why can I not get to the Bronx then? Okay, Eddie, tell me where to go. Should I go up here?
Head to the North Bronx.
Yeah, okay. I'm just going to choose this area, not really fully knowing what it is, but I do want to spend some time here, and I know we only have 6 minutes, but I want to show you a couple new things that are really important I am hoping to help you give some information to us and then also assess whether this scenario is totally off the mark or not. In this case, what we have now is, if everyone's seen where my screen is, I've got that little play button, and I usually just go to this little like up down arrow thing, and that moves me around, which is fun. But now one of the coolest things I can do is actually go to this like dot square, the dashed square. And through that, it's letting me select certain things. So if I'm curious about why certain adjoining areas here are DACs versus not, I'm selecting it. I've selected those. 6 of them are DACs and 4 of them are not. And what I get down here now is the census tract numbers, whether it's a DAC or not, their burden and vulnerability percentile scores, so that I can see where they land, the median income for that census tract, the percent BIPOC, the red line score, and whether it's a PIJA area, like what percentage of that census tract is designated a PIJA. Then I can be like, oh, well, dude, you're totally wrong about, let's see if I can find one that I think I'm totally wrong about. Maybe this one? This one up here, I'm wrong about. And it's gonna then input that census tract number over here. And I think it should be a DAC. And I can say, high red line and lower income. And then I can hit submit and then click and I submit it. And now we have that information so that we can fine tune things. Any questions? Because I know there's some chat things, but it's like off to the side, so I can't quite see it all.
When are we supposed to do this? Do we have a deadline here, Alex?
Well, so we're running on crazy times. So you know, I think one of the things is like we're trying to make it as easy as possible, and we're going to submit this. We have to upload it onto the web server, and we're going to try to do that by today or tomorrow. And then we're going to send you a link so that this is just like on a website for you to go through. And then in the next couple weeks, this is what would be super important for you to do. Now, since we have the luck of meeting next week as well, we're going to try to like build this out more and come up with more scenarios and fine tune it. But I feel like it would be disingenuous to me to say like, well, do this tonight or tomorrow or by next week before our meeting. That's just not possible. Any information you provide on this one gets funneled into that percent agreement overall, which then gives us, it's not live, but here's the 4 diagnostic tables for this scenario. Let's let it do its thing. And this then gives us the information that we really need for that percent agreement of responses, which for some reason is really big right now. But here you go. And then we're going to be able to build more and be able to understand, well, this scenario really captures this part, but it's missing this. And it's not, it's totally capturing this, and we really like this scenario. That tells us a lot. That is the most long-winded answer of saying there's no deadline per se, but as soon as possible is great. And we are working really hard to get this up on the server to you so that you'll have it by this week.
Alex, quick.
And Alex, sorry, go ahead.
Yeah, quick question from this is Jared. Will you be updating the tutorial PDF that you circulated a few weeks, maybe months ago now?
Yes, absolutely, we will. So I'm going to work on that tomorrow and send it out so that you have that in addition to the link so that they'll both be married together. But this is also, I want to kind of come back to this. What would help you? We've talked about small groups or one-on-ones, which I'm more than happy to do. We can update that PowerPoint that gives the tutorial. Is there anything else that you think could help you go through this crazy map thing that we've built? I want to make it as easy to get your input as possible because that really helps make sure that we're capturing what we need. Well, think about it, because I know we only have 1 minute left and we like zoomed through a ridiculous amount of information today. But do know that we're very open to creating whatever is most useful for you to get to the point where you can make these votes and do these decisions. As a recap for today, I heard a little bit more, you all wanting a bit more information on the indicators of what we selected and why. Particularly specific to how to make sure that we're capturing Indigenous populations in those areas. So those 2 things we'll address definitely next week. Is there anything else I am missing that you would like us to make sure we cover next week? Okay, well, it is.
And we'll put out a call for additional agenda items as well, right? So we can, you know, finalize an agenda end of this week.
Yeah, thanks for sticking with us through the crazy 1 hour, let's cover everything at once time. We will send out that link and the PowerPoint coming out in the next couple days once we get it up on the server.
Thank you.
Thank you all.
Okay, thanks everyone. So next meeting is scheduled for next Wednesday, the 23rd at 11 o'clock. So we'll see everyone then.
See you then.
Thank you.
Bye-bye.